You wouldn't know it by looking, but more than half of the dogs at our shelter carry dangerous blood parasites. These invaders are silent, sneaky, and deadly, unless we stop them. Stick with us to the end, because you might be the hero they need. Blood parasites are microscopic invaders, tiny protozoa or bacteria, that sneak into a dog's bloodstream and quietly start destroying red or white blood cells. They're mostly spread by ticks, especially the brown dog tick, which thrives in hot, humid places like southern Thailand. And here's the kicker: many dogs don't show signs until it's already serious. Let's meet the worst offenders, 4 blood parasites that show up again and again in dogs across Thailand. Each one has its own nasty tricks. Some destroy red blood cells. Some target platelets. And some make your dog sick just by eating a tick. Let's take a look.
Wait, what do you mean by cycles? Do you mean to tell me that Anaplasma platypus comes riding on a bike?
No, silly. Anaplasma platypus is a blood parasite that specifically targets platelets, the cells that help blood clot. What makes it tricky is how it behaves. Here, let me show you. In short, cycles means the parasite causes the platelet levels to rise and fall in repeating waves, making the illness sneakier to detect and diagnose. So how common are these parasites in Thailand? Well, at one shelter in the south, over 56% of the dogs tested positive. Nearly half had Ehrlichia canis, just one parasite. Some dogs even had 2 or 3 infections at once. And most looked completely healthy. So why are shelter and street dogs like ours at such high risk? The answer's simple: ticks. Warm climate, crowding, close contact, and dogs constantly coming and going. It's a paradise for parasites. And if even one dog has a tick problem, the whole shelter can be affected. Prevention is not optional, it's critical. Here's the tricky part: many infected dogs look just fine. But inside, these parasites are already draining the life out of them. The early symptoms are easy to miss, and by the time we notice something's wrong, the damage may already be serious. Spotting the signs. Early stage. Mild fever. Tiredness. Low appetite. Advanced stage. Pale gums. Bruising or nosebleeds. Swollen lymph nodes. Muscle pain or trembling. Some dogs show no signs at all, until it's critical. These parasites are experts at hiding, so we need the right tools to catch them. A basic microscope can help, but it often misses mild or early infections. That's why many shelters now use PCR testing. It's like a parasite fingerprint scanner. Fast detection means faster treatment, and better chances for recovery. How do we know a dog is infected? We can give microscopy a go. It's quick and low cost. However, it may miss early or mid-infections. It's a good start, but not always good enough. Then there's good old PCR testing, which is great as it detects hidden or multiple infections. It's highly accurate, even with no symptoms. Early diagnosis equals better survival, exactly what we want. Here's the good news: blood parasites can be treated. But it's not a one pill and done kind of thing. Different parasites need different meds, and some dogs need weeks, or even months, of care. That's why early detection saves lives, and money. Let's briefly chat about treatment options for infected dogs. Babesia. Right for this nasty we have imidacloprid injections, fluids, sometimes a blood transfusion. Ehrlichia, anaplasma. This guy again, get rid with doxycycline for 28+ days. Hepatozone, he looks a real buffoon. Get rid with some long-term antibiotics and pain relief. Ensure to support with lots of rest. Also fluids and liver protection. If you catch it early, then recovery is very likely, which is the goal. So what's the outcome for a dog with blood parasites? That depends on how early we catch it, and how strong their little body is. Many dogs make a full recovery with the right treatment. But left untreated, some infections can cause lasting damage to the organs, or worse. With early diagnosis and treatment, full recovery is possible. Delayed care equals risk of liver or kidney damage, chronic pain or weakness, and long-term immune system stress. The best way to stop blood parasites? Prevent them from getting in at all. It doesn't take fancy equipment, just regular care. Every dog, everywhere, deserves that chance. Use monthly tick prevention, for example spot-on treatments, collars or tablets. Keep living spaces clean and dry. Bedding, kennels, yards, ticks thrive in damp places. Test dogs when possible, using basic blood smears or PCR if available. Separate sick dogs to prevent spread. Spread awareness your community. You can share signs, symptoms and tick dangers. Remember, prevention is simpler, kinder and far cheaper than treatment.